So for the next segment of our program, we'll turn our attention to calf health, management, and nutrition. And to kick us off for that piece, it's my pleasure to introduce Dr. Dave Renaud, my colleague from the Ontario Veterinary College, who will give us an overview of some of his very productive research program and team with recent findings around improving calf health. Please welcome Dave.
All right, good morning, everyone. Thanks for the introduction, Stephen. So over the next kind of 20-25 minutes, I'll take you through some of the work that we've been doing with our research team, really trying to understand how do we improve calf health, how do we improve calf survival. Where I thought we'd start our presentation is with a picture of a calf that's sick. And I wonder if we could do a show of hands. How many of you have been to a farm and seen a sick calf? Diarrhea, respiratory disease? Yeah, pretty much everyone has probably seen that. And I'm sure maybe one of the things that you've done when you've seen a sick calf is maybe you've wondered a little bit about what's the impact of this disease. And we've been doing a little bit of work lately trying to understand a little bit more about the short-term impacts of having diarrhea or having respiratory disease. So in these two studies, one of which is published, one of my former master's students, Matthew Shinwald, he went out and got data from 2,600 calves that were fecal scored twice daily. And then he evaluated what's the impact of having diarrhea in terms of their mortality and also their growth. We also have a data set from respiratory scoring of about 1,000 calves where we evaluated them for 77 days. This is what the scoring system looks like for those of you who aren't familiar with fecal scoring. It's really fun, and doing 2,600 calves is a lot of fun. Yeah, it's a dream job for Guy, that's right. And so you go out and you evaluate the feces, see what the calves are basically putting out, and then you see if they have a fecal score of 2 or 3, runny or watery feces. That's a consideration that calf has diarrhea. Similarly, there's other scoring systems that are out there for respiratory disease, and what we used was this one for the UC Davis respiratory scoring chart, so made from your colleagues at UC Davis. And we looked at a variety of different symptoms: eye discharge, nasal discharge, cough, ear droop, head tilt. And if they had a score of more than 5 or 5 or more, they're considered to have respiratory disease. And then we looked at the 77-day period after they had disease to look at what's the impact of these diseases on these calves. So where I'll start is with mortality. If calves had no disease at all, so no diarrhea, no respiratory disease, their baseline risk of mortality in this data set was about 2%. So dying from other reasons like maybe naval infections, maybe injuries, and other components like that. If they had diarrhea, and we classified diarrhea as 1 day or more with diarrhea, they went from a baseline mortality risk of 2% up to 4%. So an increase of 2 percentage points over that 77-day period. If they had respiratory disease, much more severe mortality risk, going up to 13% mortality in that group of animals. What we also found in this data set was something quite interesting, is that diarrhea kind of serves as a disease or a gateway disease towards other diseases like, for example, respiratory disease. And what we found in this data set is that calves that had diarrhea, so maybe I'll use this pointer so everyone can kind of see. So calves that had diarrhea, 1 day or more with diarrhea, they had an increased probability or risk that they would have 1 or more days with respiratory disease. So it was a 14% increase in the risk that they would have respiratory disease. So we found that diarrhea is potentially a gateway disease towards other diseases like respiratory disease. So what we created was this group on the bottom, this diarrhea and respiratory disease. And in that group of animals, that baseline mortality risk increased to 24% in that group of animals. So when we have these diseases happening in early life, we have a substantial loss that happens and that's associated with that. That loss isn't necessarily just associated with mortality, but also with growth losses. So in calves that had no days with diarrhea, no days with respiratory disease, we found that calves gained about 1 kilogram of body weight per day. Pretty substantial growth, and that should probably be where we should strive to achieve, about 1 kilogram of body weight gain per day. If calves had diarrhea, they're losing about 80 grams per day. If calves had respiratory disease, about 180 grams per day. And then finally, this kind of pathway of diarrhea and then subsequently respiratory disease, they're losing about 202 grams per day. So we're losing anywhere between 10 to 20% of body weight gain just in that short period of time, that 77-day period that we evaluated these calves in. So we get substantial losses when we have disease happening in early life. So most of you put up your hands in terms of how common are we treating these diseases in terms of seeing it out on farm. But just to get a little bit more data behind this, here's some work that a former PhD student, Tamaki Uma, did. And in this study, what she did was she visited about 150 farms across Canada. 5 different provinces were represented. They did a questionnaire on all the different management considerations or practices with calf health. And then what she did was she painstakingly went through all the calf records these farms had, looking at the number of calves that were born, the number of calves that died, and also the total number of antimicrobial treatments that were given in this data set. She also collected fecal samples from a random subset of calves on the farm to look at how many kind of different pathogens were there, and also to look at multi-drug resistance that was present on the farm. There's 3 kind of key findings that I thought I should highlight in this presentation. The first finding is that of the 150 farms that we visited, it was only about half of them that we could actually pull meaningful treatment records from. And if we look at kind of the reasons why, potentially you could say that the cow ate their homework or ate their records in this case. But there's also some challenges in terms of data recording and how we're able to pull some of that data out of these records, whether they're paper-based or whether they're temporary, like erasable whiteboards. So we found some challenges in terms of how we could get some of this data. If we look at the remaining 74 farms that we had, overall about 30% of calves were treated with an antibiotic. So about 2,300 out of the 8,000 calves that we evaluated in this data set. If we look at the reasons for treatment, the majority of treatments were due to respiratory disease, and then a smaller subset, about 20%, were due to diarrhea. What we also found was that there's considerable distribution in terms of the amount or volume of antimicrobials that were used out there in this group of farms. So we standardized it, look at antimicrobial treatments per calf year. So it's kind of a standardized metric that we can evaluate the amount of antimicrobials that are used. And what you can see from this data set is that there's some farms that have very, very low volumes of antimicrobials they're using in calves. But equally, we have some farms that are using a substantial volume of antimicrobials, likely because they have high calf disease, or perhaps because they have maybe not the best protocols in terms of how they're treating some diseases on farms. An interesting association that we found with this group of farms that had higher levels of antimicrobial use was those that had higher levels of antimicrobial use also had higher levels of antimicrobial resistance in the pathogens that we found on those farms. So specifically, we found that about 35% of the E. coli isolates we found in this data set were multi-drug resistant, meaning that they're resistant to 3 or more antimicrobials. And if we look at those high antimicrobial users, farms that had high antimicrobial use were about 9 times more likely to have multi-drug resistant isolates on their farm. So what I want you to take away from this is when we have calves like this, when we have sick calves, we obviously have those impacts with regard to losses in both loss of the calf, but also losses in growth, but also an increased risk with a chance that we're going to have multi-drug resistance that can result with these calves. So what I want to spend a bit of time on is talking to you a little bit about the research that we've been doing over the past few years, trying to manage the disease on dairy farms. And specifically, there's 3 areas that I'd like to touch on. The first, and probably the most important, and what's a calf presentation without talking about colostrum, but successful transfer of passive immunity, really critical. We've done a lot of studies over the past 5 years. I've only been at the university for 5 years, but we've done quite a few studies on calves, and honestly, the single most important thing that you can do is ensure that you give colostrum right away. There's no other magic bullet that's out there. This is the magic bullet. The other critical aspect is making sure that we're identifying disease early in the onset. If we can identify it early, probably can prevent a lot of those long-term ramifications that I talked about earlier. And finally, the last piece that I want to talk about was reducing pathogen exposure. And this is specific to Salmonella Dublin. Salmonella Dublin is an emerging disease in Ontario, and I think we need to take note and take action on this particular pathogen. So let's start with colostrum. Colostrum has lots of different components in it. Immunoglobulins, bioactive factors, many different components that really help and improve calf health. And if we look at trying to achieve passive immunity, which is trying to get enough immunoglobulins absorbed into the bloodstream of calves to protect them against disease, these are the 4 kind of key factors that we want to think about. Making sure we get enough quantity of colostrum, high quality, feeding it quickly, and also ensuring that we have low bacterial counts in the colostrum as well. But I think one thing that we often forget about is ensuring that we're quantifying how well we're doing on dairy farms with regard to passive immunity. And it is quite easy to quantify. It's a simple blood sample. You go into a calf that's between 1 to 7 days of age, pull a blood sample, and just simply see what its level of serum IgG or serum total protein is. It's quite a simple and easy thing to do. In our surveys of Ontario dairy producers, we recently surveyed producers and found that about 26% of producers tested for failed transfer passive immunity, or actually collected those blood samples. So I think there's a big opportunity out there to create farm-specific data to see where you are with regards to passive immunity. If we look at where we want to achieve in terms of passive immunity, there's some new kind of guidelines that have come out by this person down here, Jason Lombard. Traditionally, we've been at these levels trying to achieve greater than 10 grams per liter of IgG. That's really been the threshold that we've been trying to achieve. But recently there's some data that's come out to show that we should be striving to achieve much higher levels and get closer to this 25 grams per liter to really protect the calves against disease and protect them against mortality. To emphasize that, here's some data from 2,600 calves, that same data set I talked about earlier, where we had serum total protein from all the calves arriving to the facility. And what we found is that calves are, especially in these poor and fair categories, had a lot lower risk of survival comparatively to calves that were in that excellent or even in those good categories. So if we can feed that colostrum and do a really good job with that colostrum right off the bat, we can protect the calves pretty substantially against the risk of mortality and also the risk of disease. I also thought it was important to emphasize how much we've improved over time in the Ontario dairy industry with regards to passive immunity. There's still probably an opportunity to improve on many farms, but I think we deserve a little bit of a pat on the back in terms of what's changed through time. It's really nice to see Ken here today, Ken Leslie, one of the pioneers of calf research at the University of Guelph. He did a really good study in 2004 where he visited 100 different dairy farms and collected blood samples on about 500 calves. And at that time in 2004, it was about 37% of calves had failed transfer passive immunity or were in this poor category. We tried to replicate that study in 2019, where we also visited 100 farms, collected blood samples on about 1,200 dairy calves. And I think what you'll see is 15 years later, we've had a substantial decline in this level of failed transfer passive immunity. So about 20 percentage point decline in that level. So I think we've done really, really well to try and improve our levels of passive immunity, but there definitely are opportunities out there to still challenge and move forward and improve. And to highlight that, here's some data this is from 30 BC dairy farms from one of my former PhD students, Devin Wilson. And what she found is there's considerable distribution in terms of how well some farms are doing. So if you look at it, kind of benchmarking all the different data points, we got poor in red, fair, good, and excellent. You can see some farms that are doing an exceptional job with colostrum management. And equally, there's some farms that have an opportunity to improve. So I really encourage to go out and to take some blood samples and really see where you are with regard to passive immunity. The next piece to talk about with colostrum is what else can colostrum do? And I think Hannah McCarthy has a poster today, I think looking at transition milk feeding and the importance of doing that. But we've also looked a little bit further in terms of other utility of colostrum as well. And I think Javi Carter, a former master's student, is here who did this project. So what Javi did was we went out and we enrolled calves with diarrhea, about 108 calves at a calf rearing facility. And we rolled them into 3 different groups. We either kept them on a control group where they're just fed their regular milk replacer diet. And then we had 2 other different colostrum groups. So we had a short-term colostrum group, which was 50% colostrum replacer, 50% milk replacer, for 4 consecutive feedings. And then we had a long-term colostrum group, which was 8 consecutive feedings of this mixture. If you look at kind of the nutritional composition, the mixture was higher in crude protein, higher in IgG, which makes sense, but very, very similar levels of energy between the 2 groups. Then what we did was we followed these calves for 56 days after they enrolled in the trial to see what's the impact of using colostrum as a potential therapy for diarrhea. And what we found was quite interesting. So calves that were in that long-term colostrum group, that 8 consecutive feedings of that mixture, resolved diarrhea about 2 days sooner comparatively to our control diet. Also, when we looked at growth over that 55 or 56-day period, they gained about 100 grams per day more comparatively to our control diet. So almost bringing them back to the baseline to almost if a calf didn't get diarrhea at all. When we looked at antimicrobial use, we found no differences in antimicrobial use. We found no statistical differences in mortality, but numerically, if you look at the difference, 14% of calves in the control group died and none in our long-term colostrum group. I think it kind of speaks for itself. So all this to say, colostrum is very, very useful, not just for the first feeding, but also beyond that, looking at transition milk feedings, looking at it as a therapy for different diseases, and we're starting to explore that in a little more depth and a little more detail, and we'll continue to do so over the next few years. The next piece to talk about is making sure that we're identifying disease early. And we've done a lot of work in this lately using precision technology as a way to make it easier to identify disease early in its onset. If we look at our gold standard, how can we best identify disease in calves? Well, we can go back to what I talked about earlier, those fecal scoring or those respiratory scoring charts. So going out daily, looking at fecal score of 2, 3, looking particularly in days 3 to 14 days of age, that's where most diarrhea happens. But I think the challenge for a lot of producers is they got lots of things on their plate, and probably going out and looking at fecal scoring might not be top of the list. So one of the things that we've been trying to do is, well, how do we make disease detection a little bit earlier? And how do we identify that this calf is sick without doing those more intensive health scoring parameters? And one of the things that we've looked at is the utility of sickness behavior. So like us, when we get sick, when we're feeling a little bit sick, maybe we're going to hang out on the couch, maybe we're not going to eat as much food. The same happens for calves. They kind of have this physiological cascade of different events in response to infection and in response to injury. And often what they do is they alter their drinking behavior as a response to that development of sickness. And to emphasize that, here's some studies that one of my former master's students did, Meredith Conboy. And in the study, she looked at calves that had calf diarrhea, and she matched them to calves that were completely healthy, didn't develop diarrhea at all. And then what she did was she looked at their milk intake behavior as well as other feeding behaviors as well. And she found some interesting differences that I'd like to emphasize. The first difference is you can see milk intake here on the y-axis, and then we have days relative to diarrhea diagnosis on the bottom here. On day 0, that's where we started to see that abnormal fecal score. So when the feces changed to that score of 2 or 3. And what you'll see is even one day before the calves are exhibiting those clinical signs of diarrhea, we start to see a change in their drinking behavior or drinking patterns. And specifically, you can see a drop in milk intake about one day before they're showing those clinical signs. And on the day of diarrhea, a pretty substantial drop in milk intake. We've developed kind of an algorithm to use this to predict further disease, and Alison Welka, a current PhD student, has a poster on that and an intervention on that. And it can be pretty effective at identifying disease. So using some of these feeding behaviors can be one way to identify disease early in its onset. Another thing that we've been looking at as well is this is a project that was done by Dan Guevara-Mann, who is a former summer student. And in this study, what he did was he strapped pedometers onto calves. And he looked at calves, again, that were healthy and those that developed calf diarrhea. And interestingly enough, when we looked at the total number of steps per day, days relative to diarrhea diagnosis, and again, this is the day that they're showing those clinical signs of disease on day 0, about one day before they're showing those clinical signs of disease, we're seeing a lower step count, or we're seeing changes in the behavior of calves. So now what we're looking towards is, well, can we intervene at that time point, before they're showing clinical signs of disease, before they're showing illness, with different non-antimicrobial things like colostrum, like NSAIDs, to see if we can prevent disease from happening or prevent the severity of disease from happening. The last piece I want to touch upon is looking at Salmonella Dublin. I'm sure everyone is familiar with Salmonella Dublin, or maybe has heard about it. Salmonella Dublin is really an emerging disease or emerging pathogen that's out there on Ontario and also Canadian dairy farms. And for those aspiring microbiologists in the room, this is a close-up picture of Salmonella off the Google, so thanks for that. So to emphasize the importance of Salmonella Dublin, I'll show you kind of 2 different studies that we've done. One was done by a former master's student, Kate Perry, and one by a current DBSC student, Sebastian Numa, who's graduating soon. In these studies, what they did was they visited 100 dairy farms across Ontario. It was a convenient sample of dairy farms, so not totally representative of the industry, and I think it's important to emphasize that. We looked at kind of a questionnaire looking at associations between different things like herd level mortality and also Salmonella Dublin status. To determine Salmonella Dublin status, what we did was we took 20 blood samples from heifers between 100 to 300 days of age, roughly. And we also looked at 2 bulk tank samples that the farms had as well. In total, in this convenient sample of farms, again, really emphasizing convenient sample, not representative of Ontario, but in this convenient sample of farms, we had about 24% of farms that were positive for Salmonella Dublin, meaning they had at least one heifer positive and or they had a bulk tank that was positive as well. When we looked at their pre-weaning mortality risk over the first 60 days of age, we found that farms that were positive for Salmonella Dublin had a higher risk of mortality compared to farms that didn't have Salmonella Dublin, about 1 percentage point higher comparatively to the negative farms. Then using that questionnaire data that I talked about earlier, we looked at what are the associations with herd positivity for Salmonella Dublin. So one of the things which I think is pretty obvious out there is that introducing animals into your herd is a major risk factor for really any disease, but also for Salmonella Dublin in this case. So we found that herds that were introducing at least one animal within the past 2 years had a higher probability of having Salmonella Dublin compared to farms that did not have any introductions. So specifically, if they had one introduction, they had a 35% probability that they were going to be positive for Salmonella Dublin. If they had no introductions, about 18%. Also, what we found is that herds that had animals coming and going from their farm, so leaving the farm and then coming back to the farm, also had a higher risk of being positive for Salmonella Dublin. So farms that were sending out cattle to shows, sending them out for embryo transfer, sending them out maybe to petting zoos or other locations, and coming back to the farm was a major risk for that. So specifically, if they had one animal that left the farm in the past 2 years and came back, 40% probability that they had Salmonella Dublin, whereas if they had no animals leaving the farm, it was about 20% roughly. The final association that we found is the number of animals in the calving pen. Often Salmonella Dublin spreads early in life. So often from these carrier animals that look totally healthy, they're shedding Salmonella into the manure, and we have a newborn calf that's going to ingest Salmonella Dublin. And what we found is that if you have a high number of animals within the calving area, that's associated with a greater risk of Salmonella Dublin. Specifically, herds that had more than 3 animals in their calving area had a greater probability or greater risk of having Salmonella Dublin on their herd. Likely because we have higher probability that maybe we have a carrier animal within that calving pen shedding it into their manure. So with that, these are the 3 main projects that I wanted to highlight. And I'll just leave you with a couple of takeaway messages from this presentation. I think disease is pretty common out there in our industry, and I think it's an important thing that we start to mitigate and really focus on it in terms of reducing the number of calves that we're treating for these diseases, the number of calves that get these diseases. I think if we can really focus in on it, we're going to have improved rates of growth, improved rates of productivity, and ultimately improvement in animal welfare due to decreased mortality. In terms of prevention, I think the first and most important thing to focus on is making sure that we're getting that calf off to a good start with colostrum. I think it's really important that we get our own numbers on individual dairy farms to see where are you with regards to passive immunity, because that might identify an opportunity for change on that farm. I think early disease detection is another kind of interesting thing that we can explore, and we have identified some behaviors that can lead to early identification. And the next question is, well, what do we do? How do we intervene on those calves to maybe prevent disease from occurring in those animals? And then finally, biosecurity, I think it's really important to emphasize that. We have new pathogens on the horizon, Salmonella Dublin being one of them, and I think we need to implement really good biosecurity practices to prevent those pathogens from gaining access onto our farms. So with that, I'd like to thank all the sponsors of the research, but I'd also really like to spend a bit of time focused on these group of people, some of the folks that are here in the room. Without graduate students, without kind of all the work that they do, none of this happens. And I think it's really important that we kind of emphasize the importance of them in terms of the work that we're doing. So thanks to all the grad students that do the work on these projects. So with that, happy to take any questions.
Thank you, Dave. Questions for Dave? Lucas?
Dave, I'll just bring a question from the genetics point of view. As a geneticist, I understand that exposing them to a pathogen is not what we want. We want to keep them safe and not getting sick at all. But wouldn't be the point of trying to make these animals more resistant or more resilient to it, to the point that they might become infected and they get back to healthy status as quick as possible and not sick for a long time?
Yeah, for sure. I think genetics can play a big role in terms of improving resistance and improving their immunity, perhaps. So yeah, I think that plays a large part in it. I still think that even if you have the most resilient animal, but you put them into an environment where they're exposed to high pathogen load and all that stuff, and maybe not managed correctly, I think they're still going to get disease. So I think it's kind of that combination of really focusing on, the genotype of those animals, but also the environment that we're putting those animals into, for sure. Yep.
One more? Tom?
Yeah, I think there could be some protection in colostrum, especially for dams that are exposed to salmonella. There's some work in the US looking at vaccination of animals with salmonella, Dublin vaccines, and that can kind of improve their immunity a little bit. But I think the largest part is trying to prevent exposure to that pathogen in early life and trying to break that transmission cycle. I think we could definitely give them colostrum. It's going to give them a little bit extra immunity if they have kind of antibodies against salmonella. But I think the most important thing is really trying to break that exposure to those feces that have the Salmonella Dublin within it.
Let's thank Dave for a great presentation.